Picture this. You're ready to go to bed, you're tired, you lie down to go to sleep, but then that old familiar feeling of that back pain, leg pain, tingling, that achiness starts coming up within a few minutes of you going to bed. It causes you to keep shifting and fidgeting and trying to find a nice position in order so you can get a good night's sleep. It may even get so bad to where you just have to get up out of bed and start walking around. In other words, it's wrecked your night's sleep and it's going to ruin the next day. This is all caused by that condition, lumbar spinal stenosis. Hi, my name is Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. And I've helped thousands of people throughout the years with lumbar spinal stenosis, including myself. I'm going to show you the postures that you got to avoid while you're sleeping, and then I want to show you the safest, most effective postures that will help ease that pain throughout the night when you're sleeping, and so you can wake up refreshed and restored and ready to take on the day. So it's important to have a routine right before you go to bed. You should do a couple of these little exercises right before you go to bed. So it means if you like to read, do it right after you read. Perform these exercises. And the first one is you want to do some spinal rotation and twist. So you can either fold your arms across your chest like this, or you can keep them loose but keep them high, brace abdominals a little bit, and rotate back and forth to mobilize that thoracic cage, which gets really stuck with people with lumbar spinal stenosis, and perform 50 repetitions. Next exercise, you're going to lay down in your bed. You're just going to fold your leg across your knee, and you want to rotate from side to side. So you're going to rotate, you're going to kind of keep your leg pressed out like this, and then you want to rotate it in. And you just want to do about 5 to 10 of these rotations. It's going to help the hips, so you're going to get the internal, external rotators along with the low back muscles, and just mobilize that area. And just breathe, take deep belly breaths as you're going through these rotations. Last exercise is going to be some flossing of that sciatic nerve. So you just interlace your fingers around your hamstrings and your thigh. You want to point the toe towards your head, and you want to drive up with your knees and just nice and loose extend that knee and feel that sciatic nerve just glide through that butt, or you may feel a little bit of tension down through the leg. So perform 5 to 10 repetitions on both sides. So I find that typically the best type of mattresses are going to be the firm mattresses. You do not want a soft mattress, because a soft mattress will have a tendency to put too much flexion and put a lot of strain in the spine, and that can just stress that spine out to where the disc will start pushing out too far and it'll irritate the spine. A firm mattress is great. Firmer the better, I feel. However, some people may need just a little bit of extra padding within that, to where maybe they need a quilt or something on top of it, or on top of that firm mattress. Probably one of the worst positions that you get into sleep throughout the night is on your stomach. So you want to avoid the belly sleeping. When you belly sleep, you're putting your spine into an extended position. And for people with lumbar spinal stenosis, when they go into that extended position for long periods of time, it's going to close down that little canal that's already narrowed and have a tendency to flare up the lumbar spinal stenosis. Some patients where they just could not get off their belly, they'd always end up on their belly. Well, with those people, you need a pillow to place right underneath your belly button in order to flatten out that spine, take some of the pressure, so it will start opening up that channel a little bit. But you still have the problem with your head being cranked the whole night. So not the best position on your stomach, but if you have to, stick the pillow underneath your stomach at the level of the belly button. So the best postures to be in for people with lumbar spinal stenosis at night is you want to go from your back to side to back to side. And when you're on your back, you want to have enough pillows to where you can actually put it underneath your legs. So it causes a slight knee bend. That helps flatten out the lumbar spine a little bit and take the pressure off the hip flexors if they're real tight. The other thing is you want a nice malleable pillow, like I like a nice malleable cotton pillow, to where you can mold that. So you want to be able to support your neck, and here you can take that and put it right underneath right at your neck level, so your head drops back over it. And what's great about this is that you're going to help establish the natural curve in the neck throughout the night, but by giving that natural curve, it relaxes the spinal cord and takes pressure off the low back. So here's where you'd start off. And throughout the night, then you'd go from here to coming up, taking the body pillow, putting it between your legs and your arms here. Now when you go to your side with your head, because you have this space from the floor of your shoulder to your head, you don't want it to be pinching down like this. So you just mold it to a position that is going to work and fill up that gap. So you're going to go from back to side throughout the night, and that'll keep the pressure off the nerve. It helps keep that canal open wide and allow you to get some great restorative sleep. People with lumbar spinal stenosis, because of the lack of nerve supply going down to their legs, typically are going to have a greater chance of falls. And if you're over 60, people that are over falls have a greater risk of breaking hips, going into the hospital, and that's one of the major risk factors of death is when they fall. So check out this next video because it's going to go over these 3 vital moves that you need to do in order to prevent falls and that early death.